My name is James Shipp. I'm the Chief Growth Officer at AG Administrators. I'm joined today by Dixon Gillis, our Chief Executive Officer, and we're going to be discussing the NCAA Transformation Committee recommendations, specifically as they pertain to medical expenses and insurance. As many of you are aware, the NCAA Division I Board of Directors formed an ad hoc committee known as the Transformation Committee to study the relationship and ways to transform the relationship between student athletes and the NCAA. The committee presented their work and their recommendations at the NCAA conference this past year in January in San Antonio, Texas, and the Division I Board of Directors endorsed the recommendations of the committee. Those recommendations are pretty sweeping. They cover things from the academic support to other support for student athletes. And as I mentioned before, here at AG, what we focus on are the medical expenses and helping institutions to manage the medical expenses, the transfer of risk through different insurances, and risk management. The committee's recommendations relative to medical expenses and insurance really hinged on 4 different points, which I'll review at a very high level before we get into our discussion. It's the purchase of insurance for student athletes, and that is effective immediately. Financial support and expenses, and that is also effective immediately. The third bullet point is health and safety, and there's legislation that we are expecting before July 1st of this coming year to be enacted for July 1st. And then finally, the development of a holistic student athlete benefits model. That's the only thing in that entire document that is not specific, doesn't specifically have a due date, if you will, an effective date. It has been referred to the subcommittee on congressional relations, and we'll talk a little bit about what's going on there and perhaps what the thoughts and the recommendations are from the committee from that standpoint. So Dixon, the first bullet point there is the purchase of insurance for student athletes. And again, this is effective immediately. I'm going to read a little bit, but NCAA Division I institutions are permitted to purchase insurance, and I'll kind of parenthetically insert of various types because that's one of the publications that the board of directors inserted previously over the summer. But institutions are permitted to purchase insurance for student athletes. And while perhaps this has been the case, they've never specifically come out and said that. But when we think about the different insurances that an institution could purchase for student athletes, we think about health, dental, vision, disability, perhaps loss of value. And one of the interesting ones is coverage for NIL activities. And that's kind of maybe a new one for folks as this idea of NIL sponsorship has come on board. We've explored the relationship between student athletes and their institutions. And as legislation has allowed institutions to get more involved in collectives and in helping guide student athletes, we think maybe it could create a bit of an agency relationship between the athletic department and the sponsor of the NIL activity. So Dixon, talk to me a little bit about your thoughts on NIL activity insurance and coverage for those.
Thanks, James. I think it's interesting from the NCAA's perspective. I think it's really encouraging that they're trying to normalize a lot of the coverages, the benefits that are being afforded to all student athletes. I think there's also some sensation that there have been some institutions that have been providing this type of coverage, and that potentially how can we normalize or create a common denominator of coverage. One of the biggest hurdles, though, obviously, is how prohibitive is this from a cost perspective? And so how can we be very efficient within the tools that each institution has, independent of one another, to provide additional services and benefits and offerings to really enhance or improve the experience of our student athlete in a way that's very meaningful. And so obviously in the theme of NIL, how can we help an institution protect their own assets by providing coverage for a student athlete pursuing perhaps an individual financial means, and how can we encourage their benefit in a way that is truly unique over the last year or two with NIL? And from an insurer's perspective, really just having a little bit of coverage for them to, should they need access to medical benefits, should they be injured or hurt in one of these situations, I think also goes to promote an institution's brand and their ability to be, to some degree, to improve their own brand and their competitiveness within this landscape right now.
Yeah, certainly NIL, I think, has become front and center as it relates to recruiting student athletes and retaining student athletes. And I think along those same lines of expanding coverage, expanding benefits for student athletes, the second bullet point there is the financial support and expenses. And this one's also effective immediately, so it's currently in effect. But among other things, provide expenses for student athletes to participate in elite level training, tryouts, and competition, including regional, national, and world championships, and other events used for consideration for selection to a national team. I think it's interesting. That isn't specifically for a USA national team. That could be any national team if we're talking about international student athletes or even U.S. citizens who may have eligibility for another nation's national team. But this is kind of interesting where, an institution could fund, could even arrange for an elite student athlete to attend these sort of camps, training camps, ID camps, whatever they may be, or national team activities. But it does bring up some challenges from an insurance standpoint. Are you going to insure the travel, right, through a travel accident? Or, is there an agency relationship that's being created? And is there a coordination of benefit? If we're talking about in the US, most of these NGBs have some sort of coverage. But talk to us a little bit about your thoughts on how an institution might go about covering this student athlete and what they might need to think about in terms of the NGB's policy and that coordination of benefits.
It is really interesting because it could be very sport specific. It could be very NGB specific. And where does that sport kind of fall in the category of a prioritization within a certain institution, or maybe more so much the competitive nature of it? I think it's going to be very interesting to see how many schools are even aware of the fact that they could have benefits under a national governing body. Potentially, there could be a student athlete, let's just use USA Track and Field. There could be a student athlete that has an affiliation or a membership with USA Track and Field that, should they become injured or be eligible for some expenses under an institution's policy, that maybe there is other coverage that could further offset their own liability by coordinating benefits, as you say. That's the term, benefit coordination, when there are two insurances that are secondary. And so it's just good to be aware. And typically the athletic training staff or the medical personnel would be aware, but from an administration perspective, that always to potentially seek out other coverage that would be available. And we would just encourage you to talk to your insurance broker, talk to your insurance provider in place now at your institution to see always, is there other coverage available that could further offset your liability? And specific to the NGB or the Olympic sports that could be relative to this second bullet point, is there coverage available as a membership? And how can we have access to that? It's always good to ask. It never hurts to ask. And maybe there's a financial benefit that could be applied to a certain situation.
Talk to us a little bit about some of the bells and whistles around business travel accident that might be very attractive in covering some of this risk.
Well, James, I think you hit the nail on the head as far as if anybody's talking about insurance on an institution's campus, to engage your risk manager, director of insurance, somebody potentially in student affairs, somebody who might have a policy or a process that could be in place that could be unbeknownst to athletics. It's really important to engage some of those key leaders across campus in the case that there is a benefit eligible that A, you're not providing redundant coverage, and B, you're saving yourself a little bit of your money on your budget. Specific to individual trips, there could be a BTA policy associated with a blanket travel for students or student athletes. There are also very, very affordable 24-hour coverages that not only include your traditional accident coverage, but also sickness. That would also be inclusive of faculty and staff that are traveling or other members of your traveling party that could benefit from this. I mean, we're talking pennies on the dollars. Take your typical swimming team that might go to Puerto Rico for spring break training for 10 days. That could be maybe $1,500 for your entire team to have 24-hour coverage that's very robust, very rich. The idea is that you make sure, number one, you're protecting yourself from any gap of your exposure. And number two, you're protecting the assets of the institution so you don't have to self-fund something potentially, and when you can transfer that risk at a very affordable cost.
Yeah, at this point, I want to turn to the third bullet point, which is health and safety. And this was one that was referred to the NCAA Committee for Competitive Safeguards and Medical Aspects of Sport. We are expecting legislation due before the end of this year for enactment for July 1st for this coming year. So it'll be a very quick turnaround. But there are several things under health and safety that the Transformation Committee recommended. One of them is formalizing some requirements for health and safety, developing training and education, designating specific responsibilities, mandating appropriate reporting structures, and empowering the campus athletics healthcare administrator at Division I schools. And we work with a group, and we partner with a group called USCA that we think very highly of. And Dixon, talk to us a little bit about the work that USCA is doing in trying to really set standards, or at least help institutions understand standards of care.
Absolutely. And as far as this bullet point, hey, we all know the burdens and the challenges that we face in providing this level of care for all of our student athletes across every sponsored sport. And that's always been an interest and a priority of a school. But I think now more than ever, with us being the guidance that's being passed to provide even more and to document this to the extent that we are, is it's a tough tug of war. And it's very difficult for these schools to be providing even the minimum amount of coverage right now as from a health care administrator's perspective. And so to have some tools in the marketplace, like James said, USCA, which is an acronym for United States Council for Athletes' Health, that is providing best practices, training, emergency action plans, and they have them in a variety of different ways to access, whether you want one item or you want a very comprehensive overhaul of your program and assessment, so to say. They can really meet you where your needs allow them to be met and provide very meaningful accredited resources to provide this next level to your student athletes. And we would encourage you to seek out those resources. It's almost, what does it cost you if you don't seek out these resources and engage? I think that's more the dialogue than how much does it cost. But very thoughtful, professional, meaningful resource that we partner with to make sure that best practices are being available to all of our partner institutions.
How can an institution really wall off their risk to the best extent possible?
A variety of different processes need to be reviewed, approved, and ensured that they are in place with the appropriate amount of support. Here's the challenge. It's going to take more resources to make these applicable or to implement and to enforce, so to say. But specific to the coverage extending beyond the departure from a program, I mean, that's going to put a lot of burden on the athletic training staff. So those need to be appropriately staffed and resourced and allocated. But just little things like the exit interview is critical. Return to play assessment, your PPEs, your pre-participation evaluation, those things are critical to be documented, and also establish those protocols should somebody not follow through with some of these mandated processes, like fulfilling your exit interview within a certain amount of time frame. We say 21 days from the departure of a program. I mean, typically we all know if a student athlete's leaving, they're disgruntled, they could be frustrated, there could be a challenge with the coach. They need to make sure that this happens in that moment of perhaps frustration, or else it could forfeit their benefits eligible to them through an extended departure from a program. And so just little things like that go a very long way to protect an institution down the road from having an issue where they're being told from the next school that they're financially responsible for the continuation of a treatment under their physician's protocol. So again, talking to your athletic training staff, your medical personnel, your healthcare advocates, your general counsel's office, your risk manager's office, to make sure the narrative is consistent across all the silos on campus. That's very important. A lot of these schools right now are doing this now. And again, this is just a matter of the NCAA coming out and trying to level set the playing field, so to say. But it's so critical to remind and to reaffirm the process by which you will be executing coverage that's going to extend beyond the departure, so that you truthfully have a very robust and documented process behind your the departure should something go awry, or should there be an issue or some point of contention that obviously a lot of the blame could be focused on the institution, not the individual.
Talk a little bit about some of the things that we've talked about around mental health, and thoughts you have around that standpoint.
Well, it's not just for athletics programs. It's obviously for campus-wide. The number one concern from presidents and provosts has been clearly voiced to be mental health for their students, their faculty and staff. And so what kind of protocols do you have in place to address these situations? A lot of the ambiguity as it relates to insurance is a lot of the athletic insurance, all athletic insurance, doesn't provide for preventive mental health regardless of an injury while participating in athletics. And so how can you provide support and resources and awareness to your constituents, whether they be student athletes or your entire campus, that is meaningful, is not overly cost prohibitive, and can be a real value? And I think it could tie into the NCAA's guidance of providing more insurance of various types, whether you're putting in place potentially costs associated with a mental health application. There are a number of them out there, some that are supposed to meet somebody at a critical need, but some that are also more of a lifestyle supplement that can be considered as part of an offering for an athletic department or student body. And so the biggest thing is to make sure you also have something in place should something happen, not only for the family of a situation, but also for those around who've become witness to perhaps a crisis or an act of violence, the unthinkable, as we sometimes characterize it. And so whether it's insurance, but I think even more of a process and protocol for emergency action plans and for triaging a situation for an individual in a meaningful way to help them offset what we think of could be the worst case scenario.
And the last thing to kind of wrap up our discussion is this development of a holistic student athlete benefits model, and particularly I think where a lot of folks are looking for answers and looking for guidance is increased access to medical coverage for athletically related injuries for a minimum of 2 years after the completion of the athletics experience. Talk a little bit about what that means and maybe how that would or would not translate to the insurance world.
Well, from an insurance perspective, it's not going to mean too much as far as actuarial updates to providing additional coverage beyond their departure from a program, right? Currently, you could have a 2-year benefit period on your secondary policy, or maybe a 4-year benefit period or a 5-year benefit period. So for many programs, that could be in place already. I think it's more a matter of how are you going to follow the continuity of care for a student athlete, whether they're completed their program or whether they, as we talked earlier, are departing from a program. And I think that's, again, James, as you pointed out, having a very tight policy. I think that's just very applicable here, to have a tight policy around how are you going to maintain contact with that student athlete or perhaps with the medical professional. And then, of course, how can you offset any abuse of that policy, right? How can you make sure that you're actually treating for an injury that occurred while representing an institution versus something that happened as a personal deviation on their own time, whether it's just something completely unrelated to their participation in athletics. And that's where a lot of the burden will fall on the athletic trainers and the medical personnel and staff. And so I think from an athletic leadership perspective, it's making sure that you have the appropriate investment in the people and the policies and the support of this in this environment where they're being asked to do more with most likely less resources.
Dixon, a lot going on, a lot to talk about. Really appreciate your time and your insights.
Thanks, James. It's always a privilege.